So this panel is all about stigma and treatment when it comes to addiction. This is key and vital to our faith communities because there's such a common outlook that addiction and falling victim to addiction is a moral failure. And that is not true. That is simply untrue. However, that is what culture has created addiction to be, and also plays a part in the silence of our faith communities. We want to overcome that and empower you to overcome that because this can save lives. Living with the stigma of addiction is what forces people to live with the trauma of it in silence, without visiting with people as confidants, without seeking help, without going to somebody to have treatment. This is vital if we are to serve people in our community. So please, please enjoy this panel from Lance Lang, who is one of the panelists. He is the founder of Hope is Alive Ministries. Teresa Stevenson is also a part of this panel, and she's the Director of Medication and Stimulant Use with the Department of Mental Health and Substance Abuse Services. And Meg Cannon, the Regional Prevention Coordinator from NorthCare. This panel is also, once again, facilitated by our program manager, Michael Eric Owens, and I encourage you to spend time to listen and to engage with their words. Thank you.
Well, according to Johns Hopkins, many Americans view poor individual choices, lack of discipline as a cause for opioid addiction. And these numbers, I think, are staggering. 78% of Americans believe people who are addicted to prescription opioids are themselves to blame for the problem. 72% believe that people addicted to prescription opioids lack self-discipline. And so when you have this sort of societal view, there's a huge stigma surrounding the opioid epidemic in our country. Let's talk a little bit about that stigma. And what do you see in your areas of expertise when it comes to this stigma? Anyone on the panel?
I'll jump in. I'll tell you just a brief story. So it's not been 24 hours since I led a funeral for a young lady who died of an opioid overdose this weekend. And I got the privilege to journey with her for the past 3+ years. And I can tell you, she was an extremely disciplined person. She was actually very capable of achieving anything in this world that she wanted to. We had even hired her on staff for a while, and she was very instrumental in the growth of Hope is Alive and what we're doing across the country. She was focused. She was creative. She could take direction. She could lead new initiatives. She was fully capable. Came from a great family, 2 doctors as parents, in fact, and unfortunately, got a what we would call in this world a bad batch of opioids with some fentanyl laced in and overdosed this weekend. And so I just tell you that to say that I think that's the stigma that we're facing. And it's been faced for over 10 years that I've been in recovery, just over 9, but working on 10. That this is an epidemic of people under the bridge that are coming from backgrounds that are not so savory, lots of issues historically in their lives, and of course that is the case in some instances. But the opioid epidemic has hit the suburbs, and it's hit families just like everybody on this call and watching this, in every single church, from whatever denomination or background or financial well-being you might have. It doesn't matter who you are or what your last name is. It's out to seek and kill and destroy, and so that's just a brief story that's really fresh on my heart this morning.
I'll jump in now. There absolutely is a stigma, and it's kind of heartbreaking because, as Lance said, addiction absolutely knows no bounds. It doesn't care who you are. It doesn't care what color you are, how much money you have or don't have, if you went to college, how many degrees you have. I've known people from, I know a pharmacist who's in recovery and has been for 20 plus years and is in recovery from opioid addiction. I know veterinarians. I know people who have way more letters behind their name than I do who are all addicted. I also know people who are homeless, who are addicted. I know, but the point is, it doesn't matter. The best way, I mean, we definitely have to do something about overcoming the stigma. We want to help people be able to overcome that stigma. And I think it's just, there still seems to be so much shame affiliated with this. And I just really hope that we are able to work with some of those people and have them tell their stories and help overcome that stigma. I think a lot of times there's power in the story of recovery. I know no one who's in recovery who isn't proud of their story. And so I think part of it is encouraging people in recovery to not hide it, to not say, well, I can't tell anybody that I was gone for 90 days because I was in treatment. I was in inpatient treatment. To be able to, when you come home, to celebrate that and to say, my gosh, it's my 90 day. I've been clean for 90 days. I've been clean for 12 months. I've been clean for, 32 years. I think that's one way that we really can work to overcome the stigma, is by helping those who are in recovery and supporting them and making sure that they celebrate that, because we all love a good celebration, right?
True, true. Yes.
So I see that a lot of people look at it as a moral failing, or what you had described as being their fault that they became addicted to any substance. And it's a sense of discrimination, almost like you are over there, you've done this to yourself, you should get yourself out of this. We don't need to be spending money, we don't need to do naloxone to save your life because you're you're doing this to yourself. And how many times do we continue to save your life? That kind of attitude is out there, and it gets perpetuated, I think, sometimes by media or by things that haven't been successful, instead of looking at all of the successful stories that have come out of individuals being able to seek treatment and having the support systems and having peer recovery supports to support them through their journey. And showing people in long-term recovery, we also forget that this is a brain disease. This is a disease. This isn't a moral failing at all. And we don't look at other diseases in the same manner that we do substance use. We don't look at the person that has diabetes that isn't taking their medication appropriately and may go into a diabetic coma, or we don't look at them as having a moral failing, or someone that has cancer. Those kinds of things is really making sure people are aware of how much of this is a disease. And our bodies naturally develop opiates in our system, and once you're putting artificial opiates, our body doesn't produce it, and so it's painful whenever someone's trying to come off or reduce the amount of opioids they're even using. And there's that stigma against getting treatment, medication assisted treatment. There's the stigma against that, like, oh, you're just trading one drug for another. Well, no, insulin, if you're not producing enough sugar or you're producing too much, you regulate it. So basically we're regulating the opioid that naturally occurs in your system. So I think, although I know education doesn't always cure everything, but it helps give some kind of background, some kind of really concrete information for people to be like, oh, well, okay, that makes sense. When they can't really empathize with other people. And I do agree. I think recovery stories are amazing because it shows that with the right supports and the right treatment, it's not all about tough love. It's about how we promote support systems for these people to be successful.
And wow, a lot of great information. And I just, when all of you are talking, I'm thinking about the face of the addiction, the picture that's being painted to the general public. is not the face of those you have described here. Yeah, they, some of those folks fit into that, but it's it does not discriminate against who it reaches. And I'm wondering, also came up in that education piece, right? So how do we begin? What are some of the resources out there, some of the methods that you think need to be employed to educate people to the realities of who this is affecting?
Well, I'll start on this one. I think that it starts around your dinner table. I think the best form of education for people is what happens at your home. And a little context for me, I'm a grandson of a pastor. I'm the son of a pastor. And I'll tell you, we never talked about drugs or alcohol or addiction around our table. And I love my parents. They're incredibly supportive, and we've certainly learned a whole lot on this 10-year journey together. But we didn't talk about it. And we didn't furthermore talk about what was predisposed within our bloodlines, if you will, coming down from my father's side, and both of his sisters and his father being an alcoholic. And he was kind of the unicorn of the group and just made it through without any problems. But it skipped a generation and landed in me. And my addictive personality was pretty well on display from a young age, whether it was collecting cards or shooting thousands of free throws and documenting every single one of them, or keeping my stats in my t-ball games. I mean, it didn't matter what was going on. I was all in on it. And I think the more we talk about it, which thank you for allowing us to talk about it, not only at home, but talking about it from the pulpit and allowing influential leaders to stand up and say, it's okay to not be okay, and to talk about that. And it's okay to talk about the crazy in your closet, because there's crazy in everybody's closet. And that's okay. And just to allow ourselves to talk about it, I think from a family dynamic and from a leadership dynamic would really open up education for a lot of people.
I completely agree with Lance. And Lance, I don't think I said it earlier, but congratulations on your recovery. That's fantastic. But it does, he's right. It starts around the dinner table. My background and what I come today to speak about mostly is prevention. My team works on opioid overdose prevention. We know that prevention starts when you are a baby. It starts super early. So as parents, it's important that we are involved in our children's lives. If you're not a parent, I am not. We just have a niece and nephews. But it's making sure that you are helping prevent those things from happening with those kids you're close with. Is having that open dialogue. It's making sure, you shouldn't hide things from your kids, at least in my opinion. When I was young, there was a woman we knew in town who was the mom of one of our friends, and all of a sudden she was gone. And I remember asking my mom, I was way 6, 7, I think. I said, Mama, where did she go? And she said, well, she's sick. She had to go away for a while. And I said, sick how? Can we go visit her? She said, well, the hospital she's in isn't here. No, we can't visit her. And I kept pushing. And finally she said, well, you know how sometimes I have to go have those shots for my headaches? And I said, yes. And she said, well, she did too, but she got to where she had to have too many of them. So she had to go have help. And that was my first true exposure that I understood to addiction, or started to kind of understand it. But just by even explaining it that way, she told me, she said, that's nothing to be ashamed of. She did have to go away, but it's also not something we just go out and tell everybody. But she explained it in a way that my 6, 7-year-old self understood. And I think that's important. I think we have to talk to our kids. I think we have to help them build those relationships, whether it's with us, whether it's with the rock star aunt and uncle, like I think that we are, or whether it's with their school counselors, their friends' parents, anybody like that. We have to build that structure. The other part is that we as adults, we as people who work in treatment, prevention, and recovery, anybody who's in the church, it's the matter of we have to go out there, and anytime we hear someone saying something about addiction being a moral failing or alluding to that, we need to stop them. We need to have the ability to be able to stand up and say, that's not really true. That's not true at all. And if you know someone who does not fit that stigma of addiction doesn't fit the person who is immoral and, what they think. You can say, hey, listen, I've heard about a pastor who has had addiction issues. I've heard about, physicians. Kind of list those people off and say, you do realize that it doesn't care who you are. It's, as Teresa said, I love that analogy of the diabetes along with mental health and with addiction. It is a disease and it doesn't care. So I think it's that calling people out and stopping them, doing so in a polite and loving way, but making sure that you are explaining, hey, that's really not what this is about. And maybe, hopefully you'll change their mind, and then maybe they'll carry that on to the next person they hear. I know I've got rose-colored glasses on as far as where that's concerned, and that I put a lot of hope in people, but I really do.
I think for me, from a statewide perspective, it's looking at shifting, culture shift, and really identifying all the points of potential contact. Meg definitely said it when she was talking about it needs to happen at every point of a person that may come in contact with, like if it's at the school or the church or in the community. And this is a community issue. It's not an individual person's issue. Some people don't have what you would consider to be blood family, but they might have family in having those conversations, or they may not have, used to when we grew up, everybody's families kind of stayed close knit in the same community. And so everybody kind of had each other's back and kept each other accountable. Well, we don't really have that anymore. Everybody is kind of a me society. I take care of me. You figure out how to take care of yourself. And I think that what would be great is to see more community come together to support one another, and to help reduce the trauma of our culture. Like Oklahoma is so high in so many of the negative things. It's like, what do we need to do to bring up those protective factors, to bring up the positive things in life that can help individuals? Substance use is, and I always relate it to Russian roulette. You don't know, right? I mean, if you know your history, you have a higher potential, but you don't know if you're going to be the one that gets the bullet. I know that's probably morbid, but it's true. I mean, you just don't know. And that's the problem. I think that, not the problem, it's probably the idea in young people's minds is that, well, it didn't happen to my uncle. It's not happening to me. So I don't think it's an issue. And then it could be his best friend. And that's the person that becomes addicted to the substance. So I think definitely, like you said, the dinner table, but in a kind of bigger sense of anytime we come in contact with someone and help them understand that this is, like you said, again, not a moral failing. This is, we got to come together to support each other and really become more of a community and a family as a whole. Like our neighbors, our family, that kind of thing.
I love that idea that it's not an individual's problem, it's the community's problem. And we know in some communities are more open than others when it comes to this, but clearly it's pervasive in every community that, you just need to pull yourself up by your own bootstraps and beat this thing, right? And we know that's just not the issue. And Meg, you kind of spoke to one of the other questions I was going to come up. What would we say to that person that believes in this stigma? And Lance, you kind of talked about that, that needs to happen at the table. When Meg said, when you hear it, you need to confront it, right? You need to have the courage to do that. But I want to just take a few minutes because of your background and what you've been through and what you do. I want to talk to that individual that's listening to us and hearing our words. What would you say to that person that's feeling that shame and the weight of the idea? Because it's just an idea, it's a false, skewed idea of a moral failing. But talk directly to that person or that loved one that knows that is on that person. What would you say to that person right now?
guess I'll keep going first. I feel bad though. Ladies should go first. But I'll hop in here. One of the services that Hope is Alive provides, Michael, is Finding Hope support groups. And these support groups are just for the loved ones of addicts and alcoholics. And they're hosted now in 15 different locations and, of course, online, because everybody's online now. And we have a motto there. And so, speaking to the loved one, this is the motto that we always say, and it's, you're not alone, it's not your fault, and there is hope. And I think when speaking to someone that's struggling with the stigma of moral failure or just not strong enough to overcome, you got to go to that second sentence there, that it's not your fault. Because what they're really trying to understand is, how am I a part of this? I can do it, but they can't do it. And they're really struggling with that juxtaposition. And I always like to tell moms and dads that if they could quit, they would quit. I've been there. They've long since lost the fun. When you go into full-blown addiction, you're not having fun anymore. You're simply surviving day to day. And it's literally what your brain is telling you: just survive, just survive, just survive. And all that you've known is to survive by using drugs and alcohol. And so what the disease is, it's a disease of choice. You've lost your ability to choose. And all you know is to choose drugs and alcohol every single day. So I think I would speak to them by saying, here's a little bit of education around the disease and why they do what they do. And secondly, you can go and find more hope and help for yourself, because recovery is a journey for the entire family, not just for your son or your daughter or your spouse. And when addiction hits your family and your home, everyone gets to have the opportunity to live in the solution. And that's called living in recovery. And so I think that's what I would say in a nutshell to somebody that's asking those questions.
I really like what Lance said. I absolutely agree about support groups. One of the groups that we work the most often with and the most frequently with is called Parents Helping Parents. It is a group that is for solely that, for parents who have children who are in active addiction or who are even in recovery. And I've been to one of their meetings. One time I spoke, and it was just the most powerful group I've ever met. They welcomed everyone with open arms. They told you at the door, there is no judgment here. There's love here, there's acceptance here. This is not your fault. We can help you. And the things that they do, so that's the referral to those support groups, the referral to that. And on a personal level, I have a very good friend who found herself in the cycle of addiction. And when I saw her, she was able to come home after she'd been in treatment for 60 days. She got a 1 week pass, a weekend pass to come home for her child's birthday. And I saw her mother when we were there, and her mother came to me and said, I feel like this is my fault. And my immediate recommendation to her was, it's not. Let's get you into some treatment yourself. Let's get you into a counselor, a therapist to talk with and to kind of work through those emotions and those feelings, because they're valid feelings. I understand that completely. But what we did was I was able to help her, connect her with someone that she could speak with that I think helped. Again, that's the case of someone who has a loved one in addiction, who is then also in recovery. But I think it's important that people understand that there are sources and resources and support out there that can help them with that.
So, and again, I'll start with the more global level and then move down. But because there's so many points that a person may interact with, whether they're the legal system or medical system, or the child welfare Department of Human Service system. And there's still a lot of discrimination and stigma around that with them as well. And really identifying what a person's fears are about a person that has a substance use disorder. Like, what are your concerns? What are your fears? How can I better understand how to convey information to you? And being able to convey information. I've actually seen it. We have family treatment courts that are in our state that work with mothers or families with children that have been removed from the home due to substance use. And the court system becomes a treatment team and a support system for them. But in the beginning, it was very difficult for a judge or a DA or ADA and a child's attorney to really be like, wait, what are we doing? We're going to give them what? We're going to understand that for the first 30 days, it's not going to be, all roses, and they're not going to be clean every single day. And so through that process, and believe me, it's a process, a long journey. However, now they're like the biggest advocates of individuals that have a substance use that are willing to participate in treatment and do all these things to get their children back. And so it has become almost like a mission for them in this work. And I think seeing those successes and being a part of that success has really opened their eyes, and the acceptance and the promotion of that people can enter into recovery and sustain into recovery. And yes, there may be times that they slip up, or they may go into full relapse, but there's a part of them that knows that they can get back to a point that can be successful for them and their families. And this is also, with DOC and things like that. And there's a lot of programs in our state that are helping those individuals that are coming out of prison, or maybe prison diversion. And it's really getting all of that information out to the community so they know that those things are actually happening. And these are the opportunities we get to have that. So we appreciate you allowing us to speak to this, because this is one of those avenues, one of those platforms where we can share that people can recover, and treatment works, and so peer recovery and recovery works, and prevention works, because the information is information that you can provide to someone prior to having a child, or prior to a child growing up. And so I think all of those things are very important. I don't know if I answered your question, but
You answered my question excellently. Thank you. Thank you so much. The stigma on addiction extends to stigma on treatment. And it says, I'm just going to toss out a statistic here, over 49% of Americans believe that there is an effective long-term treatment for opioid addiction. So less than half believe. I mean, and so it goes back to, what we've been saying during this whole conversation is people are just looking at this through the wrong lens, right? And so let's talk about treatment. What does treatment look like? What are the areas of treatment? What are the options for treatment? Let's go into that.
Okay, I'll take that one. So, well, actually, Lance, I think you're over recovery residences, correct? You have several. So that is actually a part of what we consider to be treatment, is having your basic needs met: housing, food, clothing, and those support systems. But there's treatment across our state for opioid use disorder. We have medication-assisted treatment available, and that's across the state. And that is medication that is coupled with therapy. And we have that available for our indigent. And if someone has insurance and is able to go to one of those agencies, they can. We have a lot of waivered prescribers that can provide buprenorphine across the state. However, we just highly encourage that still go to therapy, because that's the most success that people have when they have that. Understanding what medication-assisted treatment is, it doesn't mean that you're going to be on it for the rest of your life, but it doesn't say that you can't be on it for the rest of your life, depending on how severe and how long you've been using. We, as a part of our treatment world, as far as, and this is more of the state level kind of treatment, those systems have so much more wraparound services for individuals. They have peer recovery supports, which are people with lived experience that can walk these people through their journey of treatment and in recovery, and they can help them out in the community and to better navigate the systems. And we have a group therapy. There's evidence-based practices that are for opioid use disorder. There's matrix model. If you haven't heard of these, I'm just going to throw them out just so you can kind of know the language. Matrix model, the community reinforcement approach with contingency management. These are all cognitive behavioral therapy type models. And contingency management is kind of a reward system that helps encourage people to come to work. I mean, come to, well, it is work, come to therapy. And we've really worked on reducing the barriers to treatment. We actually, Oklahoma is the first state to do induction of medication assisted treatment via telehealth. So we can have a prescriber in Southeast Oklahoma prescribing to or doing induction to a person in the Panhandle right now. And so somebody doesn't have to drive 5 hours to get their medication or to get the treatment they need. Teletherapy is huge, just like you and I are talking right now on Zoom. We have that available across our state for all of any individual that wants to receive treatment in that manner. And because now they can do it at home, they could keep their job and be able to do it on their lunch hour or after work or right before and not have to travel. So those things we're continuously looking at. How do we reduce those barriers? And it's interesting, once COVID kind of hit and everybody's like, oh, now we've got to do teletherapy. They were like, the judges or the treatment providers like, oh my gosh, these people are less resistant than they've ever been. And I'm like, I don't know that they were actually resistant. I think they just had some barriers to getting to treatment. And I think that's been a huge wake-up call for a lot of people. Like, these people, the people that are experiencing in this are not being defiant, or they're just trying to get their needs met. And sometimes life gets in the way and it makes it really tough. Like, I was a single mom for 6 years. And if my mom and dad had not been around while I was working an hour away and going to college at the same time, I never would have made it. I don't know how somebody that has children that has a substance use issue is supposed to go all to treatment, get their work, find a house, find a job, all these things that we put on them that they have to do to be successful or supposedly be able to be in recovery. It makes it really tough. So I think just being aware of that, and that there are a lot of supports out in our community. We're working with hospitals now to ensure that they understand where our treatment centers are and how to connect with them. We are working with Chest Health Systems. It's an application for referral sources and to communicate via an app. And that will also have a recovery piece to it and teletherapy piece to it. So we're really working to expand all of those supports for individuals to be successful in treatment. There's also residential treatment for substance use. There's some people that need that higher level of care. And at the end of October, Medicaid will be able to reimburse for that for the first time ever. And then due to Medicaid expansion next July, that will also increase availability to services for individuals with a substance use disorder. We do have a website. It's okimready.org. Okay, I'm ready. And so that does have a platform of information. It also has a treatment locator. And we're still in development of that. So if you have thoughts or ideas that if you go and visit that and you're like, well, that didn't really give me what I need, let us know so that we can manage it in a way that's useful for people in the community as well. I don't know, is that good? Anybody else want to take a look?
Excellent. And before Lance speaks, I want to say, Teresa, that's awesome, the information that you gave out, and we really need to. We'll make that available, much more specific to our attendees of the conference, and I'm sure you'll be hearing from quite a few folks want to follow up with you on that. And Lance is at Hope Alive, and they're doing incredible work over there. So Lance, before you get into answering this question, I just want you to just speak just very briefly about Hope Alive. What is it? And what is its purpose? And then, of course, address the question at hand. Thank you.
Thank you, sir. Hope is Alive Ministries. Our mission statement is to radically change the lives of drug addicts, alcoholics, and those that love them. And so I think in context to this question, so much incredible information from Teresa. And I think a lot of times, and of course, growing up in a pastor's home, what I saw and what I see, or especially early on in our ministry, is that when addiction hit the church, and specifically the pastor's office, a lot of times, even though we do have a ton of resources in Oklahoma, they're still throwing up their hands and not really sure what to do, where to go, where to send people. And of course, we can pray for people, and I believe in the power of prayer, and I know that people can be healed, and I believe all of that, but I also know that God also uses tangible applications and people in the real world to make a difference in people's lives. And so I want pastors to know and churches to know that Hope is Alive for over 7 years has been partnering with churches to help them navigate the muddy waters and the dark waters of addiction for families. And that is a large way that we find folks to come into our homes. We also refer people to treatment and counseling and support groups like ours and Parents Helping Parents and all the great resources that we have here in Oklahoma. And our partnership with churches is what allows, I believe, a lot of pastors and staff on church staff members to understand what is treatment and how do I go about finding it and where do I go about finding it and how do I work with insurance and private pay. And I mean, it is, if you've never walked through this world and it hasn't hit your living room, I'm telling you, you just have no idea where to start. And don't even try to Google it, because all you'll get is a bunch of ads from places all over the world that are just trying to steal your information. So it's just a tough situation unless you know people. Well, the great news is you all know some people now. And, you know, I only got sober because my uncle knew somebody who knew somebody who knew something about it. And now I get to play that role, and Hope is Alive gets to play that role for a lot of people. And we have full-time staff members that literally take phone calls from our church partners and from individuals all across the world 24/7. And it's our Hope line, and I'll give it to you now. And the phone number is 1-844-3-HOPE-NOW. 1-844-3-HOPE-NOW. And you can call that number. We've got some great ladies that are in recovery themselves, that have walked through it, that understand it, that can speak the language of what your son or daughter or yourself might be going through. And so that's I think the first thing that I would say, Michael, to who is Hope is Alive and how do we help people? And then the context of what we do day to day, when you're thinking about treatment, I always use the baseball analogy. First base is a medical detox. Second base is a treatment center or rehab inpatient. What is Hope is Alive? We're third base. And so before you go home, you got to hit third base. And third base to us is sober living, mentoring homes is what we call them. Recovery residences, you can call them a lot of different things. But we have now 19 sober living homes. By the way, I want to say faith-focused sober living homes, a very important differentiating factor for Hope is Alive. Faith-focused mentoring homes in 6 cities and 3 states. There are 10 homes in Oklahoma City, 4 in Tulsa, 1 in Weatherford, Oklahoma, 2 in Wichita, Kansas, 1 now in Kansas City, Kansas, and 1 out in Morehead City, North Carolina. So we're really impacting people all across the country, and I could tell stories about that all day long. But men and women come to us a lot of times, as Teresa said, from a treatment center here in Oklahoma, and they come and they work on living out all the skills that they learned in treatment in the real world environment in a safe and sober way. And one of the ways that I think we really have stumbled upon a great deal of success is we have 25 full-time staff members, and that is their full-time job, is to walk men and women through our program. Over 190 residents now living in our homes as of this morning. And the way that this generation gets sober, I literally believe this, is you've got to grab them by the hand and walk them through the process. Short of that, and I don't care how old you are or what your background is, that is what this generation of addicts need, and that's what we're trying to provide at Hope is Alive.
Even though treatment is not my forte or my wheelhouse, there is another great resource out there for Oklahomans. Teresa, Okay, I'm Ready is my favorite website in the world because it also has our naloxone, free naloxone locator. We refer people to that all the time, and that's something that I think we'll probably talk about during the prevention panel. But the other resource that I love is 211. if you have a problem, some sort of issue, a societal problem, an addiction problem, you can call 211 in the state of Oklahoma 24 hours a day, and they will connect you. They will tell you where you need to go to get treatment. They'll explain kind of what's involved with that. Even if you don't have insurance, when you call 211, which is totally free, they will be able to say to you, okay, your nearest community mental health center is, and they will tell you where that's at. They will tell you what hours they are open. They will tell you what you need to do to be able to get in, to have that first appointment, that first assessment. And they do that 24 hours a day. If it turns out that you are in crisis and you have happened to call that number, they also can transfer you to someone who can help you through that crisis at that very moment. Of course, if it's a massive crisis, life or death, you want to call 911, not 211. But 211 is also a very phenomenal resource. I can't say enough good things about it. And Lance, again, he's got the Hope Line as well that I know also really helps a lot of people too.
A lot of great information. We're coming to the close of our panel, but I want to talk a little bit about, you have the rise in telehealth now and being able to communicate with a doctor. But I think there's people that are in situations that don't have a primary care doctor and don't know who to reach out to, and these barriers. Even we see the increase now in opioid use, even because of COVID, social distancing and being isolated. So how do we end this with this is our new normal, it seems, for the moment. How do people get access to programs that we've talked about, and maybe those that don't have internet? I mean, how do they get access to that?
So for, at least for the state level, for primarily indigent, they do take insurance and Medicaid. If say they don't have any internet, but they do have access to a phone to make a phone call, they can call the department's phone number, 405-248-9200, and ask for Tom Thomason. He has a list of all of the providers. He's kind of our access specialist, is what we can call him. Or if they have access, then they can go to a library, or they have a friend that has internet that they can look at that up. They can go to the OK I'm Ready website, and it shows all of our treatment providers. Also, anyone can contact me at 405-830-7956, and I will direct them and get them connected to a provider in their community. Every community should have access to a community mental health center or a certified addiction recovery center, and they can go directly to them or call those agencies and request assistance. Those agencies are medication assisted treatment providers. They have the prescriber on staff, they have them, they can get the medication, and then they provide the therapy as well. And for individuals that prefer or are higher level and need methadone treatment, there are opioid treatment programs in communities. There's 16 across the state. That's a little more difficult. However, some people need that level of treatment, and that medication is best for them. And so I have access to that as well. So I just, let me know, and I won't hook you up, but I will get you connected to those providers in those communities. And, again, like 211 should have access to a lot of that as well. And the OKI'mReady.org is there as well. And hopefully, I believe, Meg, that prevention has been doing a lot of outreach for those treatment providers as well. And so, yeah, so I know that they've been really trying to work with the communities and now the churches to get the word out about where to find those resources. And we've been working really diligently with the medical profession. If somebody comes into an emergency room or first responders, and ensuring they know where those resources are as well.
I'll jump in real quickly. We, as everyone did, experienced the quarantine and lived our life right here for 3 months. And during that process, my wife, who oversees all of our homes and our programming, began to hold twice weekly meetings on Zoom for our residents. And as I watched her and watched our residents begin to really change their lives via this medium, it really hit us that we needed an online platform. And so to your question, Michael, we took the best of what we do in our homes over a period of 18 months and shrunk it down and worked really hard the past 3 months to put into place an online program that provides people really all across the world now the opportunity to experience what we do within the homes. And we believe it's going to be a very, very powerful tool and mechanism. We started last Tuesday with a handful of people in our first meeting. Yesterday, we got 3 applications out of the blue, and I believe this is just the beginning stages. And so we have a handful of folks that are already using it all across the country. And yes, you do need some internet access, or at least a cell phone that you can get on Zoom and find some connection. But Teresa mentioned the library and putting in headphones and all those kind of things. There are ways to work around that. And in fact, I think we'd even be willing to provide them a computer if we had to help some folks. But the point is that we're all having to think outside the box. And so this is a new way for us to try to help people and provide what we really believe is working within our homes to somebody literally anywhere around the state or anywhere around the country. So you can find out more about that, of course, on our website. And kind of the marketing slogan that we're using is just get sober at home. So you can get sober at home, and you can go to getsoberathome.net to find out more about it.
Michael, I'm sorry, I don't want to cut Meg off at all. I want to give her an opportunity, but I wanted to also, through that research, because we do know not everyone has electronic devices, there are some websites that will, at the federal level, that will help individuals get cell phones for emergency type situations. A lot of those treatment providers have been provided some funding to be able to help with data cards, things of that nature. There's also some free resources and reduced rates on internet connectivity. And so I can send you those web links and you could put them on your web page or however you want to handle that. And yes, if somebody calls and they don't have something, some of our providers actually have driven out, dropped off a phone or whatever at their doorstep, left, and then, we're able to do assessments that way. So there are a lot of innovative, great things people are doing right now.
There's tons of ways. For me, the thought is if someone is suffering and they don't know who to go to, reach out. One area, if you don't have a device to call with or a computer, one area that I have become just an absolute advocate of are public libraries. A lot of towns, even tiny towns, have a public library. And a librarian's job, I never knew this until I befriended a librarian, is to almost know everything or to be able to find you an answer to anything you need. And they're going to have a phone that you can call with if you need to. They're going to be able to help you with internet access. They can probably advise you on where you can get that free phone, and they should be able to advise you and help you in calling 211 or calling someone for help. So again, I'm a huge proponent of that. But if you don't have a library, call a doctor in your community. It doesn't matter if it's your PCP. If you don't have one, call your hospital, just call someone. And I love the idea of this webinar and all this information that we're getting out to churches, because ultimately I would like to see all churches also have a directory or kind of an idea of how they can help people reach out to make and take those first steps. So I think this is great, and I really hope that people can help make that happen.
Well, I chuckle at the librarian note. I have a master's in library and information science. So yes, we're required to know everything. And if we don't know it, we go try to find out the information. So that's a great resource. They're there to serve the public. This has been a fantastic panel talking about stigma in treatment. And we're going to be listing a lot of the resources that you talked about, your contact information. So I know you're going to be hearing from folks that want to learn more about what you're doing. But I just want to personally thank you, because I really believe that that we're starting to bring not just attention, but really bring those out of the shadows that need, what you offer. And I think that's what we get up every day trying to do. So thank you so much for your time. Oklahoma Conference of Churches thanks you, and I think we will see some of you again during this conference. But thank you so much, and take care.